You are welcome to online lectures with From Eternity the Schoolboy. Today, we'll take a look at clinical pharmacy. And we have a question on the board. The question says, which of the following is contraindicated in type 1 diabetes mellitus patients? Option A says lisinopril. B says losartan. D says all of the above. Iota means all of the above. D, nota means none of the above. Okay, let's look at the question again. The question says, which of the following is contraindicated in type 1 diabetes mellitus patients? So, as you can see, all these drugs here are antihypertensives. They're antihypertensives. And this is another way of saying this question talks about treatment of hypertension in patients with type 1 diabetes mellitus. So it's a comorbid situation. Hypertension and diabetes type 1. So you want to know such patients that have diabetes, type 1 diabetes and hypertension at the same time, what drug should we not use? What antihypertensive should we not use in such patients? They want us to choose from these two antihypertensives. Okay, basically, the first one is lisinopril. Lisinopril belongs to the antihypertensives known as angiotensin converting enzyme inhibitors. They have effects on the kidney. And you know that the diabetes also has complications in the kidney, nephropathy. So the second one is losartan. Losartan belongs to the group angiotensin receptor blockers. It also have effects in the what? The kidney. These two affect the RAS system, renin angiotensin aldosterone system. So they have a sort of corrective effect in the kidney. So now let's look at this. Do now want to know which of them is contraindicated. Basically, none of them is contraindicated. In fact, they are the best choice when it comes to patients with diabetes, type 1 diabetes mellitus, and diabetes mellitus and the hypertension. In fact, the first line is actually angiotensin converting enzyme inhibitors, in which lisinopril belongs to. So if the patient doesn't tolerate this angiotensin converting enzyme, of course, you know the general effect, maybe this issue of dry cough or any other effect. No matter what it is, if the patient does not tolerate this, then it can move over to what? The ARBs, angiotensin receptor blockers. So basically, two of them, they are the cornerstone, they are the mainstay in the treatment of hypertension in type 1 diabetes mellitus patients. So based on this little explanation, we cannot answer this question. Options A, I accept lisinopril. Option B, losartan, I accept losartan. That is ARBs. Then iota, all of the above, good. All of the above, I'll take all of the above. Sorry, the question says you can know something and see it in the exam if you're not careful. The question says, I agree that these two are they are used in their mainstay in treatment of hypertension in type 1 diabetes patient. But let me go back to the question. It says which of them is contraindicated. So this one is not contraindicated. So it's not the answer. This is not the answer because it's not contraindicated. It's indicated. Be careful in answering questions like this. I would have failed this now. I would have ticked all of the above. You can still know a question know the answer to a question in exam, especially OBJ, and still fail it. So be careful. Make sure you marry your options with the question. So I agree, this one is not contraindicated. It's contraindicated. It's indicated, so it's not contraindicated. They want us to point out the ones that are not, that are contraindicated. Look at it, contraindicated. This one is not contraindicated. It's not contraindicated. It's indicated, so it's not the answer. B, losartan is not contraindicated. It's indicated when this one is not tolerable by the patient. You can move over to this. So this is not the answer because it's indicated. It's not contraindicated. All of the above are indicated. So it's not the answer. None of the above. All of the above are indicated. So none of the above is contraindicated. So the answer is none of the above because none of the above is contraindicated. All of the above are indicated. So none of the above is contraindicated. So the answer to this question is D. I would have mistakenly ticked A, but I corrected myself along the line. So please, the answer is what? None of the above. They are all indicated. So they are not contraindicated. So please, while answering OBJ question, be careful. You can still fail a question you know the answers. So the answer is what? None of the above. All right. Thank you very much for your attention. See you next time.